So my name is Michael Wood. I work for the NHS Confederation, Head of Health Economic Partnerships. Anything which links health and the economy is in my area of interest, and lots on the anchor work with HALN and others, and Devolution now. Got some fantastic panelists, got a bit of national, bit of local with us today. So we've got Jane Pilkington, Director of Population Health from NHS Greater Manchester. So Jane can just reflect from a city region that's been on this journey for quite a while. We've got David Buck. Many of you will know Dave Buck, who's a senior fellow at the King's Fund and has written extensively on population health over the years, and has particularly done also, Dave, some recent in-depth looking at the GM story and how it relates to health inequality. So really interesting national perspective. And then we're going to head south from Greater Manchester to East Mids County Combined Authority, one of the newest combined authorities. Jenni French, who's the housing and health consultant, and Jenni used to work at the LGA, and some just reflections from an emerging place, which is really interesting. What I'm going to do, just to set the scene, I'm going to share my screen and go through just some slides from a report which I published a week after the mayoral elections, so about 6 or 7 months ago. And the purpose of this was to look at where health fits in this devolution puzzle. And the timing of this, Julia, it's almost like we planned it. We're expecting the English devolution white paper on the 16th of December. So the last week of the year, in just over a week's time. How many fascinating aspects. You may have read in the papers some of what's been proposed. It feels quite bold. It feels quite sort of, I guess, quite, especially come from local government, quite important, a signature reform. And I think it's really important we start to understand the connection. So I'm going to talk about health in this landscape. We are open to questions, as Julia said. Stick them in the chat function, and we'll get the panel responding after my slides. So I just want to quickly run through a key points, and we'll have the link to this report if you want to look at it. We published a report in May, and what I was struck by was the growing parallels between local government devolution and integrated care systems and the reforms in health and care. And I guess they felt to me, in writing the report and hearing from the working group we had, which met over a series of time over 6 months, that it almost felt like different trains had started in different train stations in England, and we were now next to each other on the same platform in a station. And ICS leaders were looking over and saying, hang on a minute, we share an interest and a role actually in geography, in role, in purpose, in outcomes, in populations. And we had combined authorities saying, actually, yeah, all right, health and care are jumping on the decentralisation train too. So it felt like a moment in time just to say, actually, the parallels of what is linking us are quite strong in a moment. How do we learn from each other and understand how to really start bridging a gap to a more standardised sub-regional governance in England, and particularly involving the two main parts of the public sector? So what we spoke about, I'll come on to, about how actually leaders started reflecting on the need to set out and comprehend what effective integrated working could look and feel like. And that's setting out this message for local people. It's also setting out what it means for frontline leaders. Try and understand the added value of system working. We think there's something about making devolution a reality requires a three-step process of understanding people and place, supporting populations to improve their own health, and realizing health as is in everything, and making that part of everything. And I'll come on to what we think it'll make leaders have to focus on. But actually, are we really stretching what we already do or already can do with our frameworks, duties, and powers? Have we properly resourced local capacity and capability? Have we focused enough on community engagement and empowerment? And do we understand soft working and system working and soft power? So some really interesting points in that report, and I would really recommend people download it. This map, when you'll see on the right-hand side, it's changing, ever changing. On the left-hand side, it was the map back in May of the devolved parts of England. It's already out of date. You know, Norfolk and Suffolk fell before the election, whereas some other parts, Greater Lincolnshire, for example, we know the mayoral elections are taking place next year. The point of this is to say we are talking about the ongoing evolution of the subnational governance in England. And actually, what the white paper will start to colour in the map on the left-hand side, and it will start to complete the map. That's what MHG say they want to do. So we need to think about where ICS footprints map with combined authorities, and how that coterminosity might become an issue to focus on. I mentioned those train tracks meeting. If I sit within an ICS, and I spoke to ICS leaders at the ICS annual conference last week about this issue, really interesting, about actually the background to devolution was one initially of travel to work areas, that mixture of functionality and identity. And it makes us in the health sector think, well, actually, what is the functionality and identity of our own footprints? But this slide, I think, encapsulates for me just the meeting in the middle of whether I sit in a combined authority or I sit in an ICS, actually the power of that horizontal relationship. We've got combined authorities taking on health powers. We've got the fourth purpose of an ICS looking at supporting economic and social development, autonomy and place, and anchors are a core part of what we do. And I think there's something really interesting in that middle strand there, inclusive growth, population health. I mean, actually, is that two sides of the same coin? Health and the economy, intrinsically part of everything we're doing. So we are looking at where we're coming together. We've had some devolved parts of England with a health responsibility for a number of years. London, the oldest. Greater Manchester, of course, and we'll hear from Jane. But what was interesting, some recent new emerging Devo areas looking at health in different ways. So Jenni's from the East Mids. The East Mids Devo deal includes a duty there to run concurrently with local governments on public health. And the North East, anyone who's from the North East or reading the North East Devo deal, public sector reform is certainly a core part of what they want to do. And we've heard nationally about a push on public service reform too. And health is there in a few different aspects. There's a radical prevention fund they want to develop. Really interesting aspects of how health is becoming apparent in local working. On the left-hand side is the devolution framework as it looks at the moment, the very end bit of it, which includes a relation to health. The white paper might update that devolution framework. But just to say, in that devolution framework, that Levelling Up white paper published, the very last line of that is about a duty for improving health. So I think we've been late to the table, perhaps. This is explicitly economic in its origins, but health features. And I just want to focus briefly on the mayors. So we've got a new form of place leader in town. Some parts of the country are more used to mayors than others, but really we're in the foothills of decentralisation in England. There's 11 mayors at the moment, covering just over half the population. 4 of those 11 mayors have a direct personal or professional health link. And that could be, as many of us will know, Andy Burnham, former Secretary of State. It could be Claire Ward in East Mids, actually was chairing an NHS trust. Nick Johnson in Cambridge and Peter was actually a consultant paediatrician. Interestingly, Andy Burnham and Oliver Coppard both chair their ICP at the moment. And my understanding of the Devo white paper is actually that the government's preferred model going forward is that Metro mayors do have a leadership role within their ICP. So there's something about the mayors and the soft power, and I do lots of advice for ICSs on how you engage a mayor. And the questions in green are some really interesting questions, I think, for those of us in the health sector who aren't perhaps used to this form of place accountability about how we work with mayors, who are quite individual too in their thinking. The colour of their rosette matters less than the power they vest from their place. So we need to think about how we work with mayors and what our offer is to mayors and how we use Metro mayors to help solve some of our own challenges in the health and care sector. I mentioned something when I was starting about what do we want to use autonomy for? And I think that's a critical question that an ICS and a combined authority leadership need to start asking themselves. What is it you want devolution to achieve? It's not an end, it's a means to an end. And in writing the report, what was interesting, Julia, was I think leaders realizing they have to think about this. So we're seeing lots of civic think tanks coming up, really interesting as part of the anchor journey, isn't it? Helping us understand where to invest our time and what to achieve. And there were some really interesting points coming up about how we work together on health and Devo between that relationship, some principles for our relationship. And I just want to run through these quickly, just 5 points. The first point was actually, working together. There has to be a stronger together element to this. If we're not by working together being more than the sum of our parts, well, we might as well pack up and go home. There's something about system working has to help those on the front line and our populations. The second bit is actually, at the moment, sometimes a national and local perspective of health, particularly from the health sector, is a bit different. Nationally, it's about grip and it's about measures. Locally, actually, we realise that what keeps us healthy is not in the NHS. So there's something about this relationship trying to resolve those different perspectives and showing national government what works. And I think that takes on to the third point, and Richard Lees, who was a co-chair of our working group, was very clear. Local areas need to show Westminster what their offer is. So what does local working, and this comes back to evidence building here, what does local working offer government? And I think that's a really interesting way in which maybe ICS leaders haven't really thought about actually what they do, how that benefits the national. So we need to be talking upwards to Westminster with one voice. Something about how do we model that way of working? So if you want local partners to integrate at place, we have to integrate at system level, and we have to show also Westminster the power of integration. And the fifth bit is this is governing is about choice and choosing, and there's lots of quite very difficult conversations at the moment. Actually, there's something about how we understand and talk about the counterfactual of not aligning, and you know, and how explaining to public what will happen if we don't really work together. And I think that's really important. So there's something about delivering on this, and the report goes into these three. I won't go into detail now. I do think, just picking up on a few points, we do need to focus on better spatial awareness. So we understand what we do. It's not working at different levels, it's working across different levels. And actually concurrently holding powers is a really interesting challenge. I do think we need to focus on capacity, local engagement. And I do think we need to understand that we need to align local leadership about policy, about service spec, and about investment. And that holy trinity can really get us some fantastic work. And my final slide is just an overview there. And really the timing of this is vital. I think the white paper is going to stimulate lots of debate and discussion. I want the health sector to be a part of that. I think we need to stretch and understand what we can already do before we look for more power. I think we need to push devolution to be more than just economic. And I think we need to talk about health in there, and broad social purpose. We need to understand that actually we are quite centralized in this country. We need to look at decentralization. And I do think we need to start explaining the power and what we can achieve and why we should model the future. And I'm going to stop there. And that was my very quick run through. I hope that makes sense about the power of the report. Have a look at the report. We'll publish a briefing on the white paper when it comes out in a few weeks.